Mrs. Opong.
Greet the clients with respect and kindness.
I see you brought Mr. Opong with you.
Yes, I've come here to make sure that you take good care of my wife.
My husband is just joking, Auntie.
Please have a seat.
Put them at ease and offer them a private place to talk.
Oh, very good. This is a private room, so anything we discuss here today will be confidential.
Thank you.
How is your youngest child? Samuel is his name, isn't it?
Yes, he's doing very good.
I'm happy to hear it. So what has brought you to our clinic today?
Assess their reproductive goals.
Samuel is our 4th child, and we are happy with our children, but we do not think we want any more children in the near future.
Yes, 4 is keeping us busy enough.
Determine their contraceptive preferences.
Do you know which family planning method you would like to use, or are you looking for a permanent method?
No, we do not want a permanent method.
There is still a chance we may want one more child someday, but we would like to learn about methods that last many years.
I'm glad you're considering different options. Spacing children apart at least 2 years has many benefits.
We want to wait even longer.
I'm going to ask you a few questions, and then we can talk about different long-term options.
Take the woman's reproductive and medical history.
I am 30 years old.
What work do you do?
I am a housewife.
Ask about the client's bleeding patterns and the intervals between her periods.
When did you start your last period?
4 days ago. It was the 2nd time I had my cycle since Samuel was born.
How many days did you bleed with each of these cycles?
About 3 days.
Was the bleeding normal for you?
I spotted a little at first, and the bleeding was heavier than normal, but not much.
And what was the length of time between your cycles, from the beginning of your first period to the beginning of the next one?
4 weeks.
Was your period painful?
No.
Was there any vaginal bleeding that was unusual?
No.
Learn about the client's pregnancies and the dates of her last pregnancy.
How many times have you been pregnant?
4 times.
Actually, you have been pregnant 5 times.
Oh, yes. I had 1 miscarriage before I had my first child.
I'm sorry. What are the ages of your children?
Our oldest is 6, Amma is 5, Kofi is 3, and Samuel is 8 months.
When was Samuel born?
April 16th of this year.
Do you have any history of sexually transmitted infections, such as gonorrhea, chlamydia, syphilis, or HIV?
No, happily, I have never had any of these infections.
What are you doing to protect yourself from these infections?
Nothing. We are using condoms, but that is for birth control, not because I am worried about getting an illness.
Determine if the client is in a monogamous relationship.
You both seem very committed to your marriage.
He is a faithful husband, and I know I am faithful. 1 man in my life is enough.
Determine if your client is medically eligible for IUDs.
Are you taking any medication right now?
No, just something occasionally for little headaches.
Have you ever had an infection or tumor in your liver?
No, not that I know of.
Have you ever had a blood clot in your legs or your lungs?
No, not that I know of.
Do you have a history of breast cancer?
No.
Do you have a history of anemia?
No.
One long-term family planning method uses copper. Are you allergic to copper?
Identify the kinds of family planning methods your client has used in the past.
You mentioned you use condoms.
Yes, but my husband does not like them very much.
It is true I do not like them.
What is it about condoms that bothers you?
I do not like having to stop everything to put them on. And I'm sure you have heard other men say this. They take away some of the sensation for me.
I understand. This is very common.
I am also worried about them breaking. We do not need a happy accident right now.
Have you tried any other form of birth control?
I used to take the pill, but I found it difficult to remember to take every day.
Many women also find it very difficult to remember.
It made me anxious.
If the client appears to be a candidate for implants and IUDs, counsel her about those methods.
Since you're both interested in long-term family planning, we can consider two options: the implant and the IUD.
Discuss any misinformation they might have.
I don't know about implants, but my brother's wife told me that IUDs can get loose, float in your body to your heart and even to your brain.
Yes.
I've heard of this concern before, but an IUD or an implant will never float to your heart or your brain. On very rare occasions, if there is a perforation in the uterus, an IUD may migrate out of the uterus, but never out of the abdominal cavity. The IUD stands for intrauterine device. It's made of plastic and covered with copper or a hormone. It's inserted through the vagina and cervix into a woman's uterus. This works by preventing the sperm from fertilizing eggs. It can last 5 to 10 years.
And what if we want a child before that time?
It's quickly and easily removed, and there's no delay in a return to fertility as soon as ovulation resumes.
We are not 100% certain about our plans.
Yes.
Some women experience side effects when using the IUD, such as heavy and prolonged bleeding and increased cramping during the menstrual cycle. But despite these side effects, the IUD is a very effective method of birth control. Out of 1,000 women using the IUD, less than 6 become pregnant.
That sounds good.
If you're interested in the IUD, we can do a pelvic exam to confirm if the IUD will work for you and insert it today.
Now explain implants and how they work.
Another option is the implant. This is also a very effective method of birth control. It prevents pregnancy in 99 out of 100 women.
How does it work?
It releases low levels of a hormone called progestin that make it difficult for the sperm to reach the egg. After a year, some women stop releasing eggs.
Can they still have children?
When we take the implants out, the woman will start to have her menstrual cycles again and will release eggs.
Good, good.
Briefly explain how the implant is inserted.
I will do a very small surgical procedure and put 1 or 2 small rods under your skin in your upper arm.
Does it hurt?
I will give you an injection of local anesthesia that numbs the area before I insert the rods. It stings a little, but most women do not find it too painful.
What are the side effects?
Describe the side effects some women experience with implants.
The most common side effects are changes to your menstrual period. You might have irregular bleeding, spotting, or heavier than normal bleeding.
That doesn't sound good.
Much of this will subside after a few months. In fact, some women stop bleeding for a year or longer. All of this is normal, and it does not mean you are ill.
Encourage the clients to ask questions.
Will my cycle go back to normal when I stop using the implant?
Yes.
And will she be able to breastfeed Samuel using either one of these methods?
Yes. Many women who use implants and IUDs breastfeed with no problems.
Okay, that is good to know.
Yes.
Now that you know about both of these methods, would you like to choose one? Whichever one you select, we can insert it for you today.
I am a little nervous, but yes, I will choose one of these and let's do it today.